Doing there, Abe?
I'm
We
good.
get
How
on
are
the
you,
same
Neil?
screen. So we're here today. This is our first live seminar. You know, always with, I don't want to get too close to Dr. Friedman. His breath is a little bit off, but mine's probably worse. But we're here. We're going to be talking about the ORBERA balloon and how to lose some weight with this technique. This is for people who have obesity with a BMI of 30. That's a body mass index, and people will be signing on. And we want, hey, Twit Girl, how you doing? Thanks for signing on. Basically, you know, if you have any questions in between, we'll stop and we'll answer. We're going to do a slideshow. We're going to answer some questions. And who is that?
Dr. Neil.
Okay, how are you? Hey, from Dallas. Dallas, you're there. Welcome. We're going to get started here. And this is Linda.
Hi, Linda.
How's it going, Linda? And if you guys have questions, you can think of them. That would be great. We're going to show our slideshow. We're going to zip through it. We'll take a break in between. And hello, London. Great. That was a really bad English accent. I am so sorry.
Can't control himself.
I can't control myself. We're going to start here. We're going to flip the screen around right now, and Dr. Friedman is going to get... here we are. We're going to talk about the ORBERA Managed Weight Loss System. So without further ado, Dr. Friedman, why don't we get started? And let's go right ahead.
So the ORBERA Managed Weight Loss System is the balloon and everything else that's involved in it before and after. So just a little overview on obesity itself. Everyone knows it's a big problem nowadays, epidemic, global epidemic, some say. You can see the differences here. Early 90s, most of the country, obesity rates no higher than about 20% in some states. Go forward almost 20 years. Now you have states where more than 26% of the population is considered obese. And actually most recent studies say that some of the states down here have more than 35% of the population is obese.
So really one in 3 people are now obese in the United States. It's pretty darn incredible. And that says CDC, which is the Center for Disease Control. So these are government, this is government data. So
yes, we didn't make this up. Obesity has a lot of social effects on people, bias, discrimination. We hear it every day in our practice. Judgmental behavior. Some people assume certain things about obese individuals. Compromised health, premature aging, shorter lifespan. It has a very large economic burden as well. In 2008, they say that 147 billion was spent on obesity itself, which is I forgot exactly what the percentage is, but it's a good percentage of the GDP of the country as a whole. As we're playing around to show you the slides better.
I want to make sure that you're seeing the slides better now that we have the camera tilted. Is that better? Thank you so much for the hearts. Any hearts that you have, we really could use them. I don't know. Am I lacking heart?
No, I think you have.
I think you gotta have heart.
I think you have.
Yes,
a very
I'm
big
lacking heart. Okay, someone said yes. Boy, we're getting a lot of hearts now. This is a heart attack, man. Okay, so here we go, Dr. Friedman, go right ahead.
So just a little about economic costs of how much more obesity costs, and you can see normal BMI, average healthcare costs. I'm guessing this is per year.
This is per year.
It's about $4,000. As the BMI goes up, the cost goes up as well. BMI of 40 or higher, which is considered class 3 obesity, it's more than $8,000 a year, and about a 90% difference from someone who's not obese. Looking over here all the way on the right, you could see, you can see the people that spend Jenny Craig or Nutrisystem. That's how much I spend a year just on those diet systems themselves.
So let me get this straight. So, Dr. Friedman, you're saying Jenny Craig, people are sticking on Jenny Craig are spending about $2,500 a year, and Nutrisystem about $3,000 a year. You know, especially like Nutrisystem meals, you're going to be spending a lot of money. It's a lot of dedication to those diet programs. So it does wind up being a lot of money. So
And how many of those people actually lose the weight that they need to lose and are successful?
Well, if we look at the statistics and any kind of studies, whether it's a paleo diet, the low carb diet, low fat, high carb, people are really losing maybe about 20 pounds, and most people regain most, if not all, the weight. So that's really the issue, is maintaining or having something to help you maintain the weight. Comes down to the bottom line of most problems.
Right. So right now, people that want to lose weight, they either diet and exercise. However, as we just said, dieting, exercising, successful in the short term, but eventually most people end up gaining the weight back. Not everyone that exercises a lot loses a lot of weight, and some people that don't, that are not that successful with just dieting and exercising alone, they add some medications. Medications help. Usually they only help for a little while, and then patients stop losing weight, or they end up gaining the weight back. Or it's so expensive they can't afford it. And then right now, the only thing we had up until recently was surgery, which is very effective. People lose a lot of weight, but it's still a surgery. Some people are afraid of it. They think it's quote-unquote too invasive.
Now, most of what Dr. Friedman and I do is bariatric surgery, laparoscopic bariatric surgery. We also are administering medications to patients as well. So Quizmia, Belviq, also Contrave. And you can use those in addition to diet and exercise, and they are quite effective. But we're missing something here, aren't we, Dr. Friedman?
We are. And what are we missing? We're missing something like the ORBERA balloon, which is
an ORBERA balloon, which we'll show you a little more.
It's filled with saline, and what it is, it's a non-surgical option where there's no incisions, there's no surgery, does not require general anesthesia, and you lose a lot more weight than you do just with diet and exercising alone. It's also a temporary thing where there's no permanent,
It looks pretty soft.
It is.
Pretty soft and
it's soft,
harmless.
pliable, hangs out in your stomach. We'll show you a video in a little bit.
So basically, we look at the plan here for the ORBERA balloon. It's not just placing the balloon. What we're trying to do is ultimately change. Yes, it is filled with saline, sterile saline, and 600 cc's of sterile saline, and we're going to talk about that in more detail. It's not just the balloon. Bariatric surgery is not just bariatric surgery. It's diet, it's exercise, it's support. And that's what's important. We do place the balloon, and that is the first part, and we educate our patients as to what the balloon is going to do for them and what they're going to feel and how they're going to feel differently. Then we try to encourage them to eat correctly. We have them see a nutritionist and follow up with the nutritionist, and then get some support from the practice. Once I place a balloon, we're calling our patients every day. Someone said basically putting in a breast implant in the stomach, and that's a cute comment, but you know what? Not to be inaccurate, the company that developed this was not a breast implant company, but the most recent company to own the balloon was Allergan, which is a breast implant company. So it is a balloon. It is similar to that, and it does go in the stomach. We have a team of support, our nurses, nutritionists, PAs, etc. We will contact you every day, make sure you're doing okay. We see you back in the office. You follow up with our nutritionist. We make sure that you're doing well. And we continue the education, and ultimately the balloon, that is, there's a question about diet, which we'll address that in a second. The balloon remains for 6 months. So we have a diet question. Why don't we continue onwards and answer that? Well, 2 questions. Is it an endoscopic procedure? Yes, we're going to talk about that. It's all endoscopic. You're knocked out for about 15 minutes. It's like you're having an upper endoscopy, and when you finish, you feel like you ate a pizza. So basically, that's it. So, Doctor, we insert the balloon and the balloon goes in with a tube. It takes up about a third of the space of the stomach once we fill up the balloon. It is actually directly inserted and put in the mouth, pushed down, and then we follow it down with the endoscope. So we're placing it under direct vision. We do not use ultrasound. It does help you, once it's in, you feel less hungry, you eat smaller meals, and you're full. And it enables you to stick to a diet. Now, someone asked us what kind of a diet, and I don't want to speak for you, Dr. Friedman, but I believe that patients should be on a, and I'm going to flip this around for 1 second. Should be on a, we're here, that's better. Patients really need to be on a low-calorie, high-protein diet. So the protein fills you up. We don't like carbs, so it really is a low-carb, high-protein, low-calorie diet. Fat is okay. We like good fats. You like fat?
I like fat.
We like good fats. My favorite fat, nuts, avocados. You can think of another good fat?
My son loves avocados.
His kid loves fat, too. I love avocados. So we believe in that diet. Our nutritionists preach that diet, and that's what we stick to. I hope I answered. You basically lose over 3 times the amount of weight you would have lost with a typical diet and exercise. Okay? And how much do you expect to lose? Now, it's important to note that we were probably the first practice, or the only practice in Connecticut, placing balloons. We were placing what's called the bib balloon, which was owned by another company, BioEnterics, and then taken over by Allergan, and now owned by Apollo. So our practice was part of the FDA trial. So long before anybody in Long Island or New York was placing balloons, our practice was placing balloons. And we were part of that bib trial. So we have tremendous experience. And we can tell you that the clinical studies done in the United States, those patients were not on anti-nausea medication. They were not on a lot of the medications that we put them on. And I'm going to have Dr. Friedman talk about the 4 medications that we put people on during this procedure. So go right ahead. What scripts do we give people?
So we usually try to manage and control the most common symptoms after the balloon goes in. One being nausea and vomiting. So we usually give a medication to prevent the nausea. Another is abdominal cramping or abdominal spasming. So we give a medication, something called Lefsin, which decreases abdominal spasm, GI spasms, to help alleviate some of the pain. We also give a PPI, an antacid, to coat your stomach, make sure you don't get erosions, ulcers, make sure you're not having pain from that either. And last but not least, we also give a little anxiolytic or a little anxiety medication, because when you're not feeling well, you're nauseous, vomiting, you get pretty anxious. But one thing to remember is that when the balloon goes in, even if you have nausea, vomiting, and pain, everything is okay as it is normal. So we give a little medication to just calm you down, make sure that you get through the first couple of days, and then you're successful with your journey of the balloon.
Someone asked, is it attached to the wall? I'm not sure I understand that, if they're being funny or not.
It's not attached. It floats freely inside your stomach. It goes back and forth, moves with your stomach.
You're right, it's not attached to the wall.
Right.
Okay, and it's not a breast implant. So what weight do you have to be to get this? Okay, great question. You have to have a BMI of 30. So a BMI of 30, if you're 5'4", that's 170 pounds. Okay, the average woman that we see is 100 and is usually 5'4". Okay, so I give that as an example. So essentially, this is how things are done. I'm going to let Dr. Friedman take over.
So this is just that's true, that is 60%.
60, yes, exactly. That's 68% of America. Actually, anywhere between 80 and 100,000 people are candidates for this balloon. And that's why we think that it can help make an impact. And I'm going to be perfectly honest. As a bariatric surgeon, I was not initially convinced of the balloon. And what we're seeing now with our first few patients is that they're doing extremely well. Much better than we expected, and we've gotten a little bit excited about it, and that's why we're starting to give these seminars and reach out a little bit more, because we think that it really can make an